Hey guys, Dr. Truesdale. Today we're going to be talking about a topic the whole world is talking about: artificial intelligence, AI. Dun dun dun. So artificial intelligence is coming for all of us. I don't care what industry you're in, it's already touching and influencing you. So whether or not you're in construction or art or business, finance, any type of business, AI is coming and we have to understand and prepare. So what is going on? I'm going to do this video as a series of videos because there's so much to talk about, and honestly, it's revealing itself as we live because the technology is advancing like crazy. First off, what is artificial intelligence? Artificial intelligence is basically computers analyzing and understanding the world and basically using things called neural nets. So neural net is very similar to the way that we learn, right? It's almost like recognition of patterns. Then when you recognize and you train these systems, right, these programs to understand and recognize things, you then can do things like predictions or deductions or new basic concepts that are going to be derived from artificial intelligence on its own, right? So eventually, artificial intelligence will have emergent properties. This means that it's going to be able to come up with new concepts, new ideas by itself, meaning it's not going to need to get input from the internet. It's not going to need input from other humans. It's going to basically come up with new concepts that no one has ever thought of, no human has ever thought of. That's coming soon, guys. So how do we prepare? How do we understand artificial intelligence in our world today? First thing that I think about with artificial intelligence, like any tool, it can be used for positive, right, or negative, right? And in plastic surgery, it's the same. We are already seeing people use artificial intelligence in plastic surgery. Some of this stuff is good and some of this stuff is bad. Let's talk about some of the things that I'm just seeing. In artificial intelligence, you have the ability to analyze data and you have the ability to generate new videos, new concepts, and visualize these things. Plastic surgery is very visual. And so I'm sure you guys have seen on your Instagram, your social media, these videos of AI, and you're like, what did I just watch? This is crazy. This looks almost real, or it does look real and I'm nervous because I can't tell real from unreal. That will happen in plastic surgery. And so people use this even now to do things that are not ethical. So I've seen videos of myself, actually my own work, being used by other kind of people on the internet, advertising things as if it's their own. They'll train a person's voice, right? Their actual voice. They'll make an AI voice to capture the characteristics of the voice, and they'll put it over someone and make it look like they're speaking. They're using this to advertise products. They're making it seem like they're putting out information that that person is not putting out. And so it can be really, really harmful.
I have nothing to do with weight loss gummies or diet pills, and I don't want you all taken advantage of by people misusing my name.
The other crazy thing about before and afters, right? In my world, plastic surgery, is people see your work and it's the transformation. Generative AI, these videos that are able to be created, you can make it look like you're a better plastic surgeon than you are, right? Historically, people edit their videos, or maybe they'll Photoshop something and they'll make it look like they're getting a better result, or they'll manipulate lighting, or they'll show different angles to make it look like people look better than they actually look. People are going to manipulate AI and they are going to try to fool the consumer. And these new tools, as it becomes ubiquitous, as people start learning how to use them, people will start faking out society. And this overall is awful for humanity, because if you think your surgeon can create a result and then they're using AI to show their before and afters, and then you happen to be one of their patients and you get botched, or you come to find out this doctor can't actually produce this in real life, it has consequences for you, right? It's unethical behavior. And honestly, I'm worried about the things that I don't even know to worry about. Right? In medicine, there's this phrase, the things that are dangerous are the things that you don't even know to know about, right? When you first become a doctor and you're an intern, you finish medical school, You have all this knowledge, right? Oh, I'm a big doctor, I know medicine, I know pathophysiology, I know how to prescribe, right? And you're in the hospital for the first time. Dangerous, right? Because you don't know what you don't know. You don't know the diagnosis that you're missing. And so that's where you can get into trouble. What are the questions? What are the concepts about artificial intelligence that we don't even know to ask, right? Well, we can hypothesize AI might try to take over the world, but what can it do to plastic surgery? What are the questions that we don't even know to ask? Will it make plastic surgery obsolete? Well, no. Plastic surgery will not be obsolete as long as people have faces and people care about the way that they look and the way that we interact in the world. Now, if we get to a world where everyone is just living in kind of a digital world and everything is kind of Mark Zuckerberg style, where we don't care about what we actually look like and we're all walking around with avatars, then maybe plastic surgery won't be a thing. Digital plastic surgeons will be a thing, right? How many tokens will you exchange for a better looking avatar, right? I guess people are already doing that. But as long as we live in the real world, plastic surgery will be a thing. Eventually, the question will be, will robots, will artificial intelligence and the real world application of artificial intelligence be able to create the beautiful results that I do every day? It's a very interesting question, because if you ask people the question, will artificial intelligence take your job? 10 years ago, people would have said no. Of course not. But look today, people's jobs are getting taken away. So it would be naive for me to think that a robot or artificial intelligence one day would not be able to perform surgery. We already see robots being able to dexterously perform surgery. Now, classically, these robots, like the Da Vinci robot here, I used to work on that when I did head and neck surgery, that's still controlled by a human. But what if the robot was able to train with human motions and perfect and understand the diagnosis, right? We already know that artificial intelligence can diagnose things kind of better than humans, right? It is great at pattern recognition. If you're putting up artificial intelligence versus a radiologist and they're looking at a film or CT scan and they're trying to figure out what is good and what is bad, right now the world is the best when you have an experienced radiologist and artificial intelligence working together. But there will be a day when artificial intelligence will be better than the radiologist, right? And so with plastic surgery, the other aspect is it is art, right? It's not just about the execution of can I do the surgery, but there's a nuance, there's a subjectivity to it, right? What looks good? Where should it be? That's where I think I have the best likelihood of sticking around as a plastic surgeon. Because even though you can ask an artificial intelligence to generate something that looks creative, it's still working within the bounds of its programming and what it's seen before. Now that's cool, but you can't tell artificial intelligence, make something beautiful and unique for this person. There is no perfect face. And so if you're training artificial intelligence to try to think about what looks good on a person, and you can see this with an app, right? Like a Facetune app, and you press auto and it'll make a face. That face sometimes does not look good because it takes, at least right now, a human to see and perceive and uncover the beauty in that face. The other thing is each face is unique. Each face is different. And so for now, I can keep my day job. Maybe one day artificial intelligence will be able to understand and be able to manipulate tissue, right? So one, it's the perception and being able to kind of perceive and generate what that likeness might look like in an optimized form, but then it also needs to be able to physically interact with tissue in human form. That's where medicine comes into play. And all those years of training, of learning how to do what I do, got me to be able to combine both the artistic kind of representation and the physical execution technically to do what I do. AI is still some years away from being able to do that. Is it 50 years away? I don't think so. I think it's coming for us. But as long as there's still some subjectivity, because it is still art, and there's still a high degree of technical demand, and let's be honest, we live in a world with regulations. People are not jumping at the bit to have robots operate on them, right? We still trust humans more than we trust robots in a lot of ways. Some ways, maybe not. Until all of those things get solved, I will keep my day job. I've been scatterbrained with this because I think we're all trying to figure out what does the world look like with artificial intelligence and where do I fit in this world. I use artificial intelligence in my practice now to try to better respond to patients or understand and synthesize, right, medical literature. I'm always constantly learning. And I can put in an article and I can spit out what are the top 5 learning points in this article. It can help me do that. I can write an email and draft it to a patient faster. Those are all good things. But down the line, what will happen if I don't exist as a plastic surgeon, right? What will the world look like? I think artificial intelligence has a lot of utility. It can help patients visualize what they might look like for a procedure. We can use it in medicine to counsel patients, to disseminate information quicker, to gain information quicker. In terms of back office, we're able to respond to patients more efficiently, run our practices more efficiently. But there's also a dark side, and I think we need to be at the forefront because plastic surgery is one of these fields that is very, very susceptible to bad actors because of its visual nature and because that's how we translate our work to others. Artificial intelligence can manipulate data and manipulate the physical world in terms of videos and photographs to make things look real, even if they're not real. Guys, I'm all over the place with this video. I hope you like my initial thoughts on artificial intelligence. I will try to create a more synthesized, more well put together video. It's a little bit more organized for you. So this is just part 1. As we dive into artificial intelligence, I will make a part 2, part 3, and part 4, and we will dive in more because we're doing research in plastic surgery. I've read multiple articles about plastic surgery and artificial intelligence. And so as I learn more, as I think and process this more, I will give you guys my take on artificial intelligence and surgery.